Welcome back to Seat at the Table. I'm your host, Justin Shore, here at Chronicles of EMS. We're talking about communications, dealing with patients that don't usually communicate the way we do. We just talked about autism. Now we're going to talk about dealing with persons who are not able to speak to us, hear us. We're talking about the hard of hearing, the deaf, and sign language for first responders.
Yes.
I was told I should learn Spanish and Chinese. Nobody really encouraged me in high school, college, or EMT school to learn sign language.
Until today.
Until a couple days ago.
Ah.
When, well, I shouldn't say a couple days ago, a little while ago when we were going to have you on the show. And I started looking into some of the resources you have available through your signing families. And also you have a DVD, Sign Language for Emergency
I have more than one
Situations.
DVD, but that's the one for emergencies, yes.
I watched that one yesterday and I thought to myself, why didn't I watch this years ago?
Mostly because I only made it 6 months ago, maybe.
That's probably why. Now, quick
good reason.
demographics. A lot of folks might be saying, I've never encountered a deaf person in the field. Do we know how many deaf people there are in the United States?
Well, that's like, there's a lot of hearing people who are experiencing hearing loss who may not be,
Describe
quote,
deaf.
Yeah.
Deaf is usually considered someone with a severe to profound loss, aided. So even with hearing aids, it's kind of touchy. It's not a black and white kind of a question because so many people now get the cochlear implant, but technically they're deaf when they take the implant off and they're more hearing when they have the implant on. So that's important for EMTs to know because if someone does have an implant, they may not have it on and then you rush to maybe think they might need an MRI or something and they may not be conscious. So you sort of have to do some investigative work and see if you see some scarring or something behind their ears. And so yeah, it's not a cut and dry question, I'm sorry. But I can tell you that sign language has been bumped up into the number of slots. So English is number 1, Spanish number 2, Chinese number 3, American Sign Language number 4.
And I'm going to put out to our audience right now, you need to move sign language up to number 2. Whatever your native
Okay.
language is, you need to start learning some sign language, at least the basic signs that you show on your DVD and on these flashcards that come with it.
Yes, or we're separate. You
Yes.
can get them.
Some of the basic ones that I learned from your video were simple things like, I'm an EMT or paramedic. I'm
Right.
here to help you. What is your name?
Well, let's show the people
Where's the
what,
name?
what those are.
Let's show them.
Okay, so this is help, or you could do it this way. It doesn't really matter. And the thought is that this hand needs help from this one.
So we're lifting the hand.
Right,
We're
but the
helping.
beauty of sign language is that I have one sign, but I can make 2 different sentences or 3 different sentences. So, do you need help? The sign goes towards you.
Okay.
Please help me. The sign goes on to me. Or just generic. Do you need, help out?
Okay. Now, approaching someone who
Right.
I think might be deaf. Am I incorrect here?
That's right.
Deaf?
Deaf, and then
So-
just point to me.
So one of the first things you might want to do when you encounter someone who you think may have something going on, just as you're speaking to them, is it okay to be talking and doing this at the same time?
Right.
Or they will show you.
Where they will show me.
Yeah.
Yeah.
Facial expression, though, is about 30% of the sign. So the sign is 30% of the time on the hand, 30% of the time on your face, and your body.
Okay.
So questions, you tend to put your shoulder forward and you make an inquisitive face. So, versus, see the difference?
Yes.
And they would then answer with the head nod, which is also part of that facial expression.
Okay. So straightforward.
That's right.
Are you deaf?
Perfect.
Do you need help?
Yes.
Now, if you respond, yes,
Again, perfect.
what are some of the things I need to do from there?
Okay, so if you're wanting to know their name, for instance.
Name. Okay.
Now, here comes the part that's a little sticky. So, learning basic sign language should never replace an interpreter. So, if you've ascertained that the person is deaf, then you want to make some time, perhaps, to get an interpreter, to meet you at the hospital, to meet you at the site, whatever is the circumstance. Learning basic sign language is the bridge till the interpreter can arrive at the scene. So, to learn their name, which is just this hand shape, one on top of the other, 2 little clicks, to ask them to write. Can they write? And then to offer them some paper. Most deaf people, including children, can write their basic name and address.
And that's why it's always a good idea to carry more than one pen when we're out
True.
in the field. And also, note cards.
Very good.
They're very easy to stuff in your pants pocket. They're easy to stuff in your clipboard, anywhere. So when I ask you, when I sign, can you write? It's not going to be good to turn around and, hold on, I'm going to get some paper, just wait here, because I don't know how to sign those things. So I need to be ready. Can you write?
Right.
And then offer it to them.
Louise, what about establishing if they can lip read? Because then you're going to approach it differently.
Correct.
If they're good at lip reading, which not all deaf people are, and that's an unfortunate assumption, then it's just a matter of knowing that you know, have good enough light so that they can see your face. And what people tend to do is they start to talk like this, thinking that if they talk louder, that somehow this person is going to magically hear them.
Yeah.
What you're doing is you're distorting your facial expression so much
Exactly.
they can't understand you. So it's a matter of, if I were to say, yes, I lip read, then Justin could just talk normally and I'd understand him, as opposed to having to go to the written meeting.
Right.
What she's doing with her hand there, is that the sign for
That's
lip
the
reading?
sign.
This is the sign for oral.
Oral.
Okay.
And then lip read is kind of like this V kind of sign, just back and forth a little
and forth.
bit, meaning the words going back and forth
Okay.
against your mouth. Yes, and also I think it's nice to know a few more signs, such as do you have pain? And then
Pain.
show me. So I'll show you and you show me. It works
Okay.
kind of like the help me. So to show me, or pain,
Show me.
where.
Pain. Where?
So that's why when I developed this card, Justin, just for for a second, I went to firehouses, I went to doctors, and I went to EMTs, and I asked them what words they wanted on there. And what I said is, I had my list, and then I had to sort of pitch a bunch of them, and put those on. But I've also was told to put the alphabet on in Spanish and English, because if they want to say, I'm having pain in my stomach, or I'm having pain in my back, but you're not getting the gist of what they're trying to pantomime, they could perhaps even just touch, the letters. So there is a lot of communication that could be done until an interpreter shows up, or until writing, but not every deaf person writes. And also, sign language is not just for the deaf. I get a lot of requests to teach people who have trachs, to teach children who have autism, like we were talking before. Children with Down syndrome, I've taught the Association of Retarded Citizens. They've actually helped me with input on some of my materials. So there are a lot of communities that integrate sign language. And also, you can be encountering a hearing child with deaf parents, and you don't want to have them be the interpreter either, because then they're privy to information that is really none of their business. For instance, if you have to ascertain if mom is using some sort of birth control, that may not be what her 9-year-old son wants to ask her. It's something like that. So
I think what's important is, this used to aggravate me a lot back when I was very much into signing, and I learned that there were a lot of challenges that deaf people have accessing 911 or trying to communicate with the people that are there, as well as, it works both ways. So everybody was a little bit intimidated, but what really aggravated me was when first responders just never made an attempt. Oh, they're deaf, okay, well, we'll just send them to the
we're
hospital
done.
and wait until we get an interpreter. There's a longer story here about a friend of mine who was very ill, basically went to an ER and sat there for 2 hours because we'll wait for the interpreter. He could have had a stroke sitting there. He was having a hypertensive crisis, and no one even thought to do a blood pressure. I mean, what would prevent you from doing that? And I worked in a community that was pretty much all Hispanic. My Spanish is kind of So I would naturally just start signing to them, and the firefighters would go, "You're signing to those Hispanic people again?" I said, "Yeah, but it's working." "What happened?" "Oh, I fell down." "What hurts?" "This does." I mean, even gestures. If
Well, I
you
was
don't
gonna
know
say,
sign, yeah,
you know more than you
You
think.
can create some level of communication, and they know how to work with you on that. So just don't not communicate with people because it's intimidating.
You can always show them the blood pressure cuff and
Right.
point to
Exactly.
the person and go yes or no.
Yeah.
You can start playing charades with your patients.
Pictionary
It-
is an excellent thing,
Exactly.
to help practice.
I think to remember that the people who call us, or if somebody calls for us, they want to communicate to us. And so there is going to be that want, that need, that desire to communicate. So like you were saying, there's a bridge, even if all you're doing is gesturing. That whole language barrier doesn't need to really be a barrier at all. You just have to be a little imaginative sometimes.
Exactly, and you could use a combination. So you can sign what you know, you can write what you need to know, you can do that gestural kind of language. You could use a chart or whatever it is. The combination, the key is that you want them to, they called you because they're in crisis. They call because they're in need of help. They have the same demands as a hearing person or a person who can communicate.
Right.
So their crisis is not any less important.
And the last thing you want to do is ignore them. And that's what
Exactly.
we're kind of used to. You know, when people can't communicate, they just walk away. How would that feel as a patient when you really have a need?
And there's been a number of lawsuits of people who have just sat there like your friend and did not get assistance, and there was no attempts. And if you live in the middle of a state in which doesn't have a lot of the deaf population, God forbid you should break down in the middle of some place and you're deaf and there's no interpreter for 5 hours, you're going to wait 5 hours while you're having some sort of medical crisis.
And it was said earlier, you know, using the tools we have at hand in a new way. That's pretty much what EMS is built on. My service has a foreign language flip chart where I can flip through some very basic questions in 10 different languages, and the patient just points to what's wrong. I don't need to speak their language. We flip it up. Are you in pain? They point to yes or no. Well, it's in English so that I can understand what they're saying. Let's use that. Sure, they're not going to use any of the languages on it, but
Right.
it's something they can read and point to. Now I can get through all my pertinent negatives. Do you have any allergies? Where are your medications? Chest pain? Number of pregnancies? All those important questions we can get out of the way. If they don't read lips,
And I bet you already know the sign for pregnancy.
I would make a tummy bump.
Right, and then a number, right, on your hand.
Yeah.
So those are the kinds of things that you already know. You're already a signer. So it's the little things like help and pain that, you know, add to the communication. But you already know
So
sign
we
language.
shouldn't be scared of it. If we
Not at
encounter
all.
someone, we shouldn't say, well, I don't know how to sign. I don't want to say something horrible. And we were discussing it off camera a little bit.
Right.
The different signs, much like speaking a foreign language, it really is a foreign language.
Right.
You can go from saying nice things to very mean things very quickly, just with a position of a thumb or
Oh, yeah.
a hand tilted a certain way. So you may accidentally say something inappropriate. However, you're trying.
They're very forgiving. They
Well, that's where you
understand you're
learn
not
this.
going to be an expert at it, but you're trying, and that's better than other people would do. So that's
Yeah.
what's important.
They'll either giggle, like some people would. They might take offense, and then you would just say sorry.
Sorry.
Yeah, that's a good
They're
one
like,
to know.
"Oops,
Yeah.
sorry, yeah.
Yeah.
Right, exactly. The key, like you said, is, you know, is to try, because not trying could cost a life.
And a good example, just real quick, sorry, with the
Sorry.
closed hand. And then if I'm not mistaken, open hand is please.
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 So please
Thank you.
and sorry. Very, very similar. And you could,
Right.
you know,
The intent is that it's over your heart, so it's heartfelt. Thank you, and then you're welcome is just thank you with a head nod for acknowledgement. You're welcome. In fact, you could just go you're welcome with the head nod for acknowledgement. So sign language does have some sort of bases. Most of it is rooted in some sort of either a pantomime that we already did or some sort like A. This is the A hand for the alphabet A. Apology. American Sign Language is based on the French.
Logical.
So a lot of the things is starting with the first letter of the alphabet of the French word. So yeah, it's very logical. You know, you could ask how many children by just signing baby, and then be like, you
yeah.
know,
I have trouble getting my English-speaking people to understand that question.
right.
You know, how many children do you have? 3. Well, I see 2. Where's the third? Oh, it's a long story. Well, I need that story. You know,
Right.
that's part of my assessment. So we really shouldn't be shut down if we suddenly find that we have a deaf person or a person that's hard of hearing. Real quick, you mentioned the cochlear implant.
Right.
And there could be a scar, and you said, but it's very complicated.
It
For
is,
our
it's a very
audience,
complicated
If
topic.
I'm led to think that there may be this in place, can you describe for our viewers what that might look like?
Well, the cochlear implant is an internal device with an external processor. And I'm not going to get into the medical because I'm not a doctor. But basically, there would be a significant type of scar. Some children who have it younger may have almost like a hairline scar. The older they would be, the more noticeable the scar. It's usually right behind the ear, but it's not at the ear. People think it's usually like right at the ear. It's usually in the hairline, maybe 2 inches above the ear. And it's a medical device, and usually there's some sort of processor either on the ear that looks like a hearing aid. But the sound comes from the top of the head. People describe where's the sound coming from. You're not hearing it in the ear. You're actually hearing it, processing it through your brain.
Is it bone conduction? as
It is
well?
bone
Yeah.
conduction. So there's a great movie called Here, Hear, and Now, which describes a family in which the mom and the dad get cochlear implants much later in life. And they were surprised. They thought they would hear it here, but they heard it up here. So that's why, you know, and it's very controversial to some people in the deaf community.
Speaking of controversy, I can't even talk. Maybe what is the sign for controversy?
Well, it depends on what. So, like to be,
In
Okay,
conflict.
so
yeah, in
there,
conflict.
I'll just do the sign instead of trying to say it. And I'm
Or-
hitting the table. What
But
does
keep
the,
signing anyway.
What does the deaf community think about being able to send text messages to 911 to be able to have better access to emergency services?
Oh, I think they would think that's great. I don't want to speak for the deaf community. Let's put it that way. But I can't imagine anyone not thinking that's a good idea.
I
So, but there might be some people who,
Yeah,
don't like it.
OMG car rollover. I can see it definitely being abused, even though it has that intent of giving more access to people in a way that they can access it. Now, before the text messaging, how did a deaf person access 911 in their community?
I have to tell you, the deaf have done their text messaging well before the hearing community because they had sidekicks.
Right.
And many states paid for sidekicks to make it, part of the ADA and stuff like that. But the thing that, the communication in the deaf communities used to be very, very tight. They had deaf clubs, and that's where news was filtered. As closed captioning and things made things more accessible to the deaf community, well, most of my deaf friends would say they can do anything that a hearing person can, but hear. That's it. So it's not the deaf versus the hearing. It's an integrated world. They happen to use, just like, if you lived in a neighborhood, I grew up in a neighborhood that had a lot of Italian families. They were part of the human race. They just spoke Italian at home. So that's the way I think of my deaf friends. I'm married to a gentleman who I'm married. My husband is hard of hearing, so we sign from time to time at home. It's just part of our life.
They have their own culture and their own cultural
Right.
rules. It's actually quite fascinating. But answering your question, Justin, I remember when I got into this, actually it was somewhat before ADA kicked in, and they had to depend on, they'd have their TDD device. But
Right.
when a dispatcher would pick up the phone, it would sound like a kid playing with a touch-tone phone, and they'd hang up. And I've heard story after story of after 3 hang-ups, they'd have to run to the nearest hearing person they could access to call 911. And there were lawsuits because people died. Because the dispatchers, and that's when I said, communication, understanding, education has to go on both sides. The dispatchers have to understand maybe that's a deaf person trying to connect with them, but they had so few calls because the deaf were afraid of doing it, it just propagated issues on both sides.
Right.
And finally, when ADA came in and there was better equipment and better understanding, it got a lot better. But it was pretty scary back then.
It's important. It is a different community, but it's nothing to be afraid of.
No.
And when I first encountered a deaf person on a call, I was scared. I was afraid. How on the earth am I going to communicate with this person? And they just smiled, and we walked through pantomiming and writing, and I thought, what was I so worried about?
Right.
I put so much on my shoulders of I won't be able to communicate that I forgot to just try.
And the worst that happens is you just start texting. So if you don't have paper and pencil with you, but you have your phone, you could just start
I've heard
texting
of
back and
people
forth.
swapping phone numbers and texting back
Right.
and forth to each
Yeah,
other.
yeah, and that's a great use of technology, and we'll talk about that in a little bit. But before we go, how can folks get a copy of your DVD?
Well, it's available at Signing Families with an IES at the end.com. You can also get it at Harris Communications, which is a huge clearinghouse for products for people with communication disorders, including deafness. But signingfamilies.com is, if you mention this, we'll even give you a little discount if you saw us here at the seat at the table. All the products, and they're all it's Spanish, English, and sign language, because we understand that many people are not only English speaking and deaf, but they're also maybe Hispanic deaf.
And your video specifically for emergency situations goes with English and Spanish.
Yes,
11 minutes on English, 11 minutes on Spanish. If you say you don't have time to learn sign language for EMS, you're lying. Because you had time to watch this
This
show
is
and it's
very
20
easy,
minutes.
yeah.
Thank you very much for having us
Thank
at
you
the
very
table and
much.
talk about sign language. A very important topic. I appreciate it.